Inflammatory bowel disease is typically a complex polygenic disorder that has large environmental impacts and influences. For most patients, they will present during adolescence or early childhood and will have gut inflammation and potentially some extraintestinal manifestations. For a very small number of patients, there will be a single gene cause or a monogenic cause of their inflammatory bowel disease, and these patients typically present during early childhood or with atypical features such as autoimmunity or immune defects. For those patients, it's really important to identify this genetic defect as it can have specific impacts on their treatment and management. To date, there's around 100 different genetic defects that can lead to monogenic forms of inflammatory bowel disease. These are mostly in immune pathways and sometimes in epithelial barrier defects. It's really important that we send the correct patients for testing, and these may be presenting with atypical features of inflammatory bowel disease. And it's also important that we meet the strict eligibility criteria for testing on the NHS, which I'll go through later on in this video. With the advent of genomic testing for inflammatory bowel disease, we have established a series of hubs across central and southern England, currently in Oxford, Southampton and Birmingham, which act as a point to refer or discuss patients within the South Central Genomic Medicine Service. We are then able to link in with additional hubs at a national level, including Great Ormond Street, that pull together additional expertise, testing ability, functional evaluation of results, and help with decisions on management of patients. Please make use of these hubs to aid with decision-making, testing and management. There are specific eligibility criteria for the genomic testing of patients with inflammatory bowel disease on the NHS. Firstly, they must have a confirmed diagnosis of inflammatory bowel disease. Secondly, age of onset is all important, with those patients aged 2 and below at age of onset being immediately eligible for genomic testing. For those patients aged between 2 and 6 years of age, if they have additional specific features, which I'll go through in a second, then they will also be eligible. And for specific patients who are older than this, including adult patients, they may also be eligible on a case-by-case basis. The additional testing criteria are infection susceptibility in the presence of abnormal laboratory tests meeting diagnostic criteria for an inborn error of immunity, inflammatory features indicative of an inborn error of immunity, such as complex autoimmune features or hemophagocytic lymphohistiocytosis, congenital multiple intestinal atresia or congenital diarrhea, early onset malignancy at the age of 25 years or under, or a family history of suspected monogenic inflammatory bowel disease. There are additional supportive features that can help decide whether a patient needs genomic testing on the NHS or not. These include family history, such as consanguinity or IBD at multiple different generational levels. In young children, growth failure or failure to thrive. Also in younger children or adults, severe perianal disease or impaired wound healing. And patients of all age, disease refractory to multiple different medical therapies, including multiple different monoclonal therapies. It's also important that genomic or genetic testing is performed prior to an irreversible treatment or a treatment that's high risk, such as a hematopoietic stem cell transplant. In patients that fulfill criteria for genetic or genomic testing to determine the monogenic form of inflammatory bowel disease, the following process should be followed. If there's any uncertainty in the eligibility or in selecting the correct testing, then please do contact one of the local hubs at Oxford, Southampton or Birmingham. The genetic testing then needs to be discussed with the patient and the family, and then typically we would aim for a trio to be sequenced, including the proband, the mother and the father. This should be discussed with these 3 members of the family, and any other affected family members should also be considered for testing. For patients, it's really important to do a record of discussion form, and this should be for each person sent for sequencing. It's also important to use a relevant request form for your local referral pathway, and the test that should be requested is the R15.4 Prime Immunodeficiency Panel, which includes the monogenic inflammatory bowel disease genetic panel. Please include as much clinical details as possible, including HPO terms. And finally, we need a blood sample, which should be collected in accordance with the guidelines on the form. Typically, this would be 5 ml of blood taken for a older child or adult, and for infants who are very young, 1 ml is required. All of the forms and the blood should be sent to your local laboratory before sending them on to the testing laboratory, and your hospital will typically have an arrangement for organising this transfer. Currently, the wait times for the results may be anywhere between 6 to 9 months, and sometimes longer if the testing is more complex. You can always contact your local laboratory for updates during this process. The Genomic Medicine Service hubs are here to help with interpretation of genetic results and also to help determine which patients should be sent for genomic testing. We have access to a range of expertise across these different hubs and also at a national level, including specific functional testing at places like Great Ormond Street. It's really important to involve these hubs and national MDTs in order to maximise the benefit that we can get from these genomic testing, but also to help with patient management and decision making about future treatment.